Assemble the armamentarium as shown here. Before you begin, note the position and angulation of the tooth that you will be working on. Optionally, you can draw the Acces outline on the tooth. Consider doing this before the rubber dam is placed, just for ease of access. Ensure that there is proper isolation of the appropriate tooth with a rubber dam. It's recommended to place the clamp on a tooth adjacent to the tooth you will be working on, as the teeth are fragile and may fracture. A separate isolation dam must be used for the anterior and posterior endodontic procedures. For maxillary molars, the Acces opening should be triangular or shield-shaped, with the apex of the triangle oriented towards the palatal aspect of the tooth. The preparation will also be located mesial to the oblique ridge. Preparations should be approximately concentric with the overall outline of the tooth at the CEJ, which follows the law of concentricity. To help find the canals, anatomic landmarks on the occlusal surface may be used as references. The palatal canal is slightly distal to the mesiolingual cusp tip. The distal buccal canal should be 0.5 mm distal to the buccal groove and lies distal and slightly lingual to the mesiobuccal canal orifice. The mesiobuccal canal is slightly distal to the mesiobuccal cusp tip. The mesiobuccal canal should be about 1.5 mm mesial to the buccal groove. When a second mesiobuccal canal is present, termed an MB2, it's located 1 to 3 mm palatal and slightly mesial to the main mesiobuccal canal. For the CDCA, you will only be expected to find 3 canal orifices, so you shouldn't have to worry about the MB2. Using a high-speed handpiece, orient the burr perpendicular to the occlusal surface in the central groove mesial to the oblique ridge. Burr options include carbide burrs, such as the 330, 557, number 2 or number 4 standard or surgical length round burrs, or the Endo Acces burr. You should utilize water cooling when using rotary instruments in this procedure. We are not using it here for visibility purposes. Penetrate the tooth to enter the pulp chamber, a depth of approximately 3 mm from the occlusal surface. As a clinical note, as long as the size of the burr is smaller than the size of the chamber, the operator will feel a drop upon entering a non-calcified pulp chamber. For the ADEX exam, to feel this drop, we recommend using the number 2 round burr. Remove the roof of the pulp chamber and begin to shape the Acces outline, starting in the center and working outwardly. It's recommended to move palatally first, then distobuccally, and lastly, mesiobuccally to complete the triangular Acces shape. We recommend using a diamond burr to initially shape the Acces opening. Once the appropriate depth is achieved, any remaining adjustments should be made with the safe end burr, such as the Endo Z burr, to minimize the risk of pulpal floor perforation. Remove the pulp from the pulp chamber. For the CDCA exam, we recommend using the spoon excavator. Frequent irrigation can help soften the wax. Use caution, as there is a risk of fracturing the accidental tooth when using hand instruments vigorously. As a note for the ADEX exam, on the accidental teeth, be sure to remove all of the pulp in the distobuccal portion of the Acces opening under the oblique ridge. Ensure there is straight line access to the orifice openings. A perioprobe is shown here, but we recommend using an Endo Explorer. Smooth the walls of the Acces chamber using a high-speed or slow-speed handpiece. We recommend using either diamond burrs or the Endo Z burr. As for recommended dimensions for this Acces opening, from the mesial aspect, the Acces preparation should be greater than or equal to 2 mm from the mesial marginal ridge. Remain distal to an imaginary line connecting the mesiobuccal and mesiolingual cusps. From the buccal aspect, Acces preparation should be greater than or equal to 1 mm from an imaginary line, bisecting the mesiobuccal and distobuccal cusp tips. From the distal aspect, the Acces preparation should be greater than or equal to 1 mm from the distal oblique groove. From the palatal aspect, the Acces preparation should be greater than or equal to 2 mm from the mesiolingual cusp tip. Finally, compare your Acces opening to the checklist on the screen. Always refer to your CDCA exam manual for the most up-to-date dimensions for this preparation. In addition, ensure that there is straight line access, smooth walls, complete removal of pulp horns, and complete removal of the pulp chamber. Thanks for learning with us!